Well, as old students return to school and new ones take their first step into the educational system, healthcare professionals are ensuring that immunization is at the forefront of everyone's mind. Appearing on Good Morning Antigua Barbuda on Thursday, Superintendent of Public Health Nursing Carolita Joseph sought to inform the public about this most important aspect of one's health. The details in this report.
Immunization is the process whereby a person is made immune or resistant to an infectious disease, typically by the administration of a vaccine. These communicable diseases consist of DPT, which includes diphtheria, polio and tetanus, MMR, which consists of measles, mumps and rubella, and influenza viruses. But why is it so important to be immunized? Superintendent of Public Health Nursing Carolita Joseph explains.
Communicable diseases kills children every year. But because we have this intervention, which is a safe intervention, and it is the most cost-effective intervention, and that is the process of immunization, giving vaccines to the children so that they can grow up, go to school and make something of themselves without having to think about the debilitating effect that these communicable diseases would have on their lives.
Each year, the International Advisory Committee on Immunization Practices, ACIP, publishes immunization schedules for persons aged 0 through 18 years. Superintendent Joseph explains at what stage a child should begin vaccination.
At 2 months, that's when we give our first vaccine here, because Antigua and Barbuda has a schedule which is incorporated in the schedule for the Pan American Health Organization or World Health Organization. These are suggestions, and so we have adopted our schedule here in Antigua, and it's also the same in some of the other countries. But we start giving our babies at 2 months. We give them something we call pentavalent. The pentavalent, first dose, it has DPT, as I just spoke to you about. It also has Hib, that's Haemophilus influenza type B, and it also has hepatitis B. So that's 5 vaccines in one shot.
The second vaccination is given at 4 months, while the third is administered at 6 months old. These are expected to make children immunized for the year as it relates to DPT. At 12 months, an MMR vaccine is required. Parents are advised to have at least the first set of vaccines administered by age 5. Despite this known schedule, there are still parents who neglect to have their child vaccinated. Nurse Joseph says for some, this may be as a result of the fear of the reaction from the child.
Vaccines are very safe, Priscilla. They're very, very safe. We get our vaccines from the PAHO Revolving Fund, that is a part of the WHO, and they make sure that the vaccines are very safe. Some children maybe would get some form of a slight reaction or some adverse effect, maybe from getting the vaccine, but they will not get the disease from the vaccine. It will just help the immune system to develop that resistance that it needs.
So for the new birth parents in Antigua and Barbuda, what do they need to know?
They come to the clinic when they come home with their babies. And you see them, there's a neonatal assessment period that is done by the family nurse practitioners. That's a category of nurses we have that takes care of that part of the baby's life, the neonatal assessment, before 28 weeks. And then the instructions will be given. They have a card, a health card. The appointment is written there saying that at 2 months, your child should be back at the health center. And it's not only say 2 months, but it gives a date. Because in each of the sections in Antigua and Barbuda, each of the areas, there are scheduled child health clinics.
For the guardians of students returning or entering the school system, she admonishes them to ensure that the child's health card is presented to the school to check for the immunization status. District clinics, however, should be the first choice of checking to ensure students are entering schools in good health. For ABS News, Tashika Lavan reporting.